This one you want to take notes. But before we begin, I want to introduce my co-host and friend, Jane Ann Bonbrake. Hello, Jane Ann.
Hey, good morning, Ellen. How are you?
Doing well. How was your weekend?
It was great. It was great. I got to do some of my favorite things, which is, I call it backyard homesteading, which is gardening and just taking care of all of our little animals. We have acquired some ducklings. My girls really wanted ducklings. And then, of course, we had our first weekend opened up for phase 1 here in Georgia. So, and I know that's our topic is the COVID-19.
I know. I just think after our last week's show with Rachel Balducci, I feel like people are wearing thin on the whole staycation. I spent the weekend reading Sunday I read this book and finished up this morning that Rachel Balducci did. It's called Overcommitted. You know what overcommitted is right now? No one's probably overcommitted because everybody's staying home. But in real life, a lot of people overcommit, and that makes people grumpy. But nowadays, we are just staying home, focusing on what's important, family and Jesus and friends. So this is a time of rest, but we invited Deacon Dr. Pat Mongan to our show. I like to call him Deacon Dear. He's my husband of 46 years. He took my breath away in May 1st, 1974, we married. So our 46th anniversary is coming up. And we all know that when you study well, as a doctor and a deacon, then God can use you. He holds you approved. He says, this man is going to go forth and help people. He has a lot of wisdom, Jane. And I said like this. My husband is a know-it-all. He knows all about everything. He really does. Some people are know-it-alls where they're know-it-alls, but my guy knows a lot. He spends a lot of his time gaining wisdom about, and he studied this subject, and we want to really know and learn. Because like I said, last week, as Rachel shared, women are getting tired. It's a long marathon, one foot in front of the other. We want to get out. I'm not the type in a cage. I'm not a homebody, and I was never so glad that my children grew up and I could go off and do things. I love my children in that season, but getting out of the house is me. So without further ado, my guy will share a little about who he is, and he's just my man. So here he is, Deacon Pat, Dr. Pat, Deacon Dear, here you are. Welcome.
Morning.
How you doing?
Yes, good. Healthy. We don't have COVID.
Amen. We're glad to have you. You don't look like you look adorable, honey, as always. I like the fact that you decided to come on our show, and you did study well to do this show. So we have questions. We felt like you should introduce who you are, because then people that know you out there, of course, everybody knows you, but say who you are.
I am a retired family medicine physician and taught at the Medical College of Georgia. I am retired, so I haven't practiced for several years, but I try to keep up with the literature and certainly keeping up with COVID. And when this first became evident that we were going to deal with this pandemic, I said to our parishioners, there are no experts in this. And you know what? As we watch the news, you continue to see that, because what they describe as going on changes rather frequently. And we have a lot more questions than answers about COVID.
I know. It's to some people it's scary, and some people are getting down on it. So I hope you address those as well as the information part. We do need the information part. What's Jada? What do you want him to cover mostly in your heart? What are you saying? I wish you would talk about. We're just giving hints. He knows. We're helping out.
Just kind of what he said is that we're still learning, and so I guess cover some of the aspects of I think there's so much confusion out there, because one minute I know there's a lot of conspiracy going on, and but I guess everybody's like looking for facts. What's really going on with this virus, and what is it attack in your body, and we've heard some of the things that help prevent it or help to take it like out of your body if you so I guess some things like that, like what can we do to help protect ourselves?
That's good.
And our family.
Yeah, and I think listening to what's going on, they give you a fair amount of good information. That one of the things that I have to tell you that bothered me from the very beginning is when they said, oh, masks don't help. Well, we know that wasn't truthful, because what are they saying now? Everybody wear masks. Mm-hmm. So I told my kids, hey, you got to wear masks. If you want to go out there, that can help protect you. But the other part of that they don't tell you, or they haven't been really saying, and if you look at all the doctors who are taking care of patients, what are they doing? They're wearing masks, and what else are they doing? They're covering their eyes because the virus can get into your eyes. And so you should, if you really want to protect yourself, then you should cover your eyes. Now, you can wear goggles. I mean, the doctors are wearing welding shields, all kinds of different things. There are shields that have been designed specifically for medical care people to prevent any droplets from coughing or whatever to get into their eyes, because that's how one of the ways the virus can get in. So Ellen and I, when we go out, we wear either goggles or safety glasses. The ideal actually is something like goggles that actually seal around your eyes. And then the other part of that is when you take off the mask and you are taking off your goggles or whatever, is, you know, they can have COVID on them. So you got to be really careful how you do that.
Oh, that's good.
So can you give us a definition of what COVID is? I can't pronounce it, more or less know what it is, but can you tell the people what it is, and should we be afraid?
Yeah, so it's, you know, a coronavirus. And so COVID is just an abbreviation and designation, because there are more than that. And, you know, one of the things that is disappointing from my point of view is, why weren't we really prepared for this? Because you can see in so many ways we weren't, and we should have been as a country, because we've had two significant outbreaks of deadly coronavirus. And in 2003, there was the outbreak that most people have heard some about, was in the news, SARS, which was a coronavirus. Didn't affect a lot of people. It wasn't easy to pass on to others. And according to WHO, which we know there may be some problems with their data information, but at this point, there are apparently 8,000 cases of SARS worldwide, and the number of people who died was about 9.6%.
Oh, wow.
That's pretty bad. And then there's MERS that occurred in 2012, and in 2015 there were outbreaks. And these, again, both of these are coronaviruses. And the mortality rate of MERS was as high as 35%.
Wow.
So, you know, but there's also been coronavirus around for a long time that causes a mild illness. But it was obviously that pretty quick we found out that this COVID-19 causes a significant amount of mortality. How much? We don't know. And if you look at the data around the world, it varies from, in Singapore, 0.1% mortality, to Sweden and Belgium, which are 11.5 and 14.6. Well, the problem here, again, like we started out with, we don't really have all the information. How many people are there who've actually had COVID? We do know from some studies that it appears there's a significant number of people who've had COVID that we don't know because they weren't symptomatic, or they had a very mild illness, never saw a doctor, so we don't really know. But we do know that the COVID can be passed on pretty easily. And one of the things when you hear this data about people, you know, population studies like in New York or Los Angeles, where they looked at larger numbers of people who weren't necessarily ill, how many of them had COVID by the tests, antibody tests. Well, you know, these tests haven't been around for very long. I'm not sure how accurate they are. And other people question that too. Mm-hmm. So how many are false positive? How much are false negative? So this is it's a moving target. As I was preparing for this, I was thinking of what my wife liked to say. It's called the practice of medicine. We're practicing, trying to figure out what's really going on. You know, educated guesses. That, you know, and a lot of this, that's the best we can do. But we do know COVID-19 can kill people, and we're finding out some unusual things about how it can kill people. For example, it appears that it may affect the blood vessels in blood such that people can be harmed by clotting. in blood vessels. There'd be people who've had amputations and things. So it's something we should take seriously, but we can protect ourselves. So, and the other part of this, if you look at mortality rate by age, it goes up significantly as people get older. Again, the tricky part of that as well is, as we get older, guess what? We have more of the underlying conditions and problems that predispose one to dying or getting in the hospital, such as diabetes, high blood pressure, and other illnesses, or having had cancer and immune therapy and things that affect our immune system. So besides the masks and the goggles, making sure we've got good nutrition, really important in terms of protecting yourself. Vitamin C, vitamin D, vitamin A, making sure you're eating balanced meals, or maybe taking a multivitamin at this time to protect you. How much difference it'll make, we don't really know, but it can't hurt to take those things and make sure you've got good levels of vitamin D, because vitamin D actually has become much more common, low levels of that, because people aren't spending much time outdoors. They're spending so much time in the front of the computer and indoors, so they don't get as much sun exposure and vitamin D. And people don't drink as much milk as they used to. So, taking vitamin D is probably a good idea.
I have a question, Deacon Dr. Pat. I was going to say, what do you think about, like, some of the states are deciding to say, come on, you can come out now. And me, I'd be like running out the door, because that would be me. But what do you think about that? Is that okay? I know Georgia, Jan was sharing, and then others. So we're still stuck in the house.
Yeah, I think I don't really have the answer to that. I think if you really look at it from the standpoint of people, the sacrifice that so many people have made, that benefits our age group, at least Ellen and I, in terms of older folks. The younger people have made a big sacrifice for us in many ways. And so we should be thankful for that. How long should they continue to make that sacrifice? Because sure, they're making a sacrifice that also benefits their parents or grandparents and older folks. But shouldn't the primary sacrifice be upon us, those of us who are at risk? So there aren't any easy answers here. And yes, younger people can die. And part of what you see happening in New York is the fact that it's so easy to transmit the virus that even if you have small death rates, that if you have millions of people get the disease, you've got a lot of people dying. And, people don't think of this much, but, a lot of people die from the flu every year. And people are dying from the flu now. So the one advantage is the flu, we do have a vaccine that helps with that. And what's going to help and make a big difference in terms of this COVID is, are we going to have a vaccine? Well, it takes a long time to develop, test, and make sure it really works.
Jane, do you have a question?
Yeah, so on the COVID-19, what does the 19 stand for? Do you know that?
That's just the designation they use in terms of there's different viruses, different names, that they give to distinguish this particular version of that virus. Because they have different genetics. And, we have a daughter who had positive test. Her husband didn't. Well, wow, we know it's pretty easy to pass, so how come he isn't positive? Are there some people who are naturally immune, or is it just a false positive? Don't know.
Right. Well, Trump did say in the beginning, he said that the tests were, basically old tests, and he started with nothing. As he says often on his press briefings, I started with bare cupboards. So he said that has been one of it. And I'm like, so you don't, like you said, false positives, so we don't really know. It seems like this is just a lot of unknown things.
Absolutely.
And so, Deacon Pat, one of the things you used to watch, and I used to love, the Mythbusters. You need to disclose some myths. Is there any myths that people should know? Like, whoa, that one, take note, and this one, that's a myth. Mythbusters.
Well, I don't know if they're myths, but early on there was just talk about the hydroxychloroquine. At this point, it doesn't appear that it really helps. Early on, I would have said, hey, if it's available, take it. But now it doesn't appear that there is any real benefit from that. So in terms of treatments, we're still working on it, trying to figure out what's the best way to treat it. And people around the country are, trying different things. And one of the advantages of having the internet is the fact that these different treatments, in terms of collecting data, it's easier to share between governments, and hopefully we'll figure out what are some of the better treatments. But it's going to take time.
It's going to take time. Well, Jane, you could go after me, but I think I was telling my husband, who I don't know anything about medicine, as he will say right off the bat, she doesn't know anything about medicine. But I was saying, when you have babies, Jan, you know how you get people that get afraid, they go into labor and they're so afraid, they have a harder time in the labor process. If you go in clueless, like I did, or if you go in without any fear, like God's got this one or I have this one, you don't have as much, it affects you. The fear affects you. So I was going to ask him how the fear affects him, because I love his answer.
Well, sure, fear, which can be a stress. So if people are stressed, that does affect your immune system, and you see doctors that are, exhausted and tired and stressed, and if you look at it, Italy, a huge number of physicians died trying to take care of these people, and now a lot of them were older. So, but how much of that was because they were stressed?
Right.
There's an issue, it's called viral load. They're being exposed to the virus. And if they didn't have good protective equipment and whatnot, they're getting exposed to lots of virus. And how deadly it is sometimes, it has to do with how much of the virus you get at one time. Because it takes time for your own immune system to respond and fight it off. Well, if you get a small amount, your body may be able to fight it off and develop the antibodies and cellular immunity to fight it off. But if you get too much, maybe your body doesn't have enough time to protect itself.
Hey, Jane Ann, what do you think?
Hey, okay. I just had a question that from some of the data that I have read. Now, I am not anywhere near, I'm not medical, but I do hear from several sources that it affects the A2 receptor, which is in the lungs. Is that true? Does it go to that one thing?
Well, yeah, it obviously attacks the lung tissue. That's one of the primary problems, and that's why people end up on respirators. And I got to tell you, the thing that is disturbing is the last data I see, and again, got to take it with a grain of salt, but the last data I saw, that people who end up on a respirator, 88% of them die.
So it could be making it worse.
And that, well, in terms of, I don't think we figured out exactly what is the best way to approach that in terms of people who need a respirator and how we should treat them. That's something people are looking at critically and trying to figure out the best use of respirators. And an interesting case was seemed like I didn't see his actual age, but a guy who looked to me like he was maybe in his 30s, not very old, who had been put on a respirator, recovered pretty well because they used what's called Ecmo. which is Ecmo's been around for a long time, and it's something that is been used, started to in terms of, it was used in pediatric cases to try to help kids in terms of perfusing their body, oxygenating their blood until their lungs could heal enough to do it on their own. Basically bypasses the lungs and gets oxygen in the blood. And so that may be something that will help. And that's been around for quite a while and help these people who are severe cases. But again, you know, a lot of these people who end up on respirators, we don't know, haven't seen really good information in terms of how many of them have heart conditions, already have bad lung conditions, how much of that is a factor. And in the elderly, as I said before, how many of those who end up on respirators, what percentage have underlying conditions versus being healthy. But we know some young, healthy people have ended up on respirators and died.
Well,
we don't know exactly what factors, our own immune systems. You know, there's been talk about blood type. I haven't seen much more about that. Is that a factor? And eventually we'll get the answers, but it may take a while because I've done research, and it usually, to do good research, to get the answers, usually takes lots of data and lots of time. It's not something that happens overnight. And we're rushing this through, and that's why things change in terms of recommendations and what to do, not to do, treatments, because again, the problem here is that even if the mortality rate is low, that a lot of people think it is, the fact that it's so easy to pass around, you have lots of people die because lots of people getting it.
So you were saying about mortality, but what about morale? Like a lot of, you know, when you were a doctor, a lot of times you'd walk in the room and you know someone's depressed right away without even like talking with them. Women especially, you know, during this season, because of the fears and worries and their children, a lot of people going down. And so what do you suggest for that, for morale's sake? Because I think that's just as important right now for the people that are healthy, but they're in home and their life has been turned upside down. Maybe they can't pay their bills. Maybe they're just like bored to tears.
Yeah, well, I don't have an easy answer to that. I mean, the easy answer for me is, I don't know how people do it without being a person of faith.
That's right.
But having faith in Jesus, the fact that, hey, we have to look forward to something, that even if we die, not so that we're not real fearful, because as Christians, we shouldn't really be fearful. We should be prudent. We should do the right things because it affects, what we do can affect other people. What we do can be deadly to other people if we pass it on to them. So we should be thinking from that point of view. But at the same time, we should keep the eternal perspective that in the end, if we're walking with Jesus, it's okay. We're gonna end up in the right place and be there for eternity. And so what's happening here is, you know, in a sense, a blink of an eye. And certainly in this country, what we're going through isn't as bad as what happened in Italy and what's probably happening in these developing countries who don't have the resources to take care of people. So, you know, we don't hear much about that. And I would suspect, but at the same time, those developing countries, people tend to be spread out more. But in this big cities there in Africa and maybe South America, people, you know, who knows how many are dying. We don't have good data and information. We don't really know what happened in China. You know? So, you know, there are these conspiracy theories, as Jane Ann mentioned, in terms of the fact that maybe lots and lots of people died, because if you look at how fast it passed around in our country, and you have these places in China where, you know, millions of people are in cities, not to think that the numbers there are worse than ours, because we have a significant percentage of the total world, quote, mortality. I'm not believing that. I'm not buying that China did better than we did or whatever, you know. So, again, we just don't know. And so prayer every day. The good thing that people have is in terms of getting on the internet and doing things and connecting with people on the internet with Zoom, Google Hangouts, whatever works for you is a real benefit, because we get to connect with our kids and FaceTime. Last night we did a family game, a trivia game, and we had our family from all over. The week before we had from Hawaii to Japan, and then everybody in our that is in the U.S. So those are ways we can connect to help. But if you have financial problems and everything, you know, look to the churches too. I think the president has looked to the churches, and I know our parish is willing to help people out. And so if you got food problems, look around. You know, I think there's lots of Americans who want to help, who are in a position to help. So look to the scriptures, look to your parish, look to the church. Even though you can't go to maybe your church, you still can connect with people in the church, and those are ways to help.
So I was going to say, and then Jan can have the next question. I was going to say that I think of these questions on air, so you don't have this one on your sheet. But if you were on the task force, you got a chance to talk to the president or a chance to talk to the people on the task force for health, what would you say to them? Would you have any thoughts? They're doing a great job, by the way. I think they're doing a great job walking the unknown without a GPS in this modern world. So what would you say?
I would say be careful what you say. Be honest and truthful. Like in a sense, you know, the whole mask thing. Okay, to sit there when they said, oh, you know, masks don't really help, they shouldn't have done that. They should have said, look, we need the masks for the healthcare people, healthcare providers. And guess what? Gee, we haven't prepared for this. We don't have enough reserves. We should have. We should have been prepared for this, but we're not. You know, and this is something afterwards that we can look towards is talking to our representatives and senators in terms of, you all should have made sure we were ready for this. That's because that's strategic too. Being healthy, if you have a sick country, then you are weak and vulnerable, and our military is then also at risk and protects us. So we should have been better prepared. And so we need to look to the future and be ready for something like this.
Jane, what do you think? Any questions? Because we're getting ready to close, not yet.
I do, but as I've been listening to both of you, you know, the word prepare comes to mind, and I'm in agreement with that. And I just think about our soul. You know, now's the time to really reflect, because everybody has thought about death at this specific time in our life with the COVID-19. I mean, and so anyway, like where is the state of our soul? I mean, those are the questions we need to be, you know, asking ourselves. You know, to me. So as I hear prepare, I look at it as the natural being prudent, and then also the supernatural, you know, asking, you know, going in prayer and asking the Lord questions, you know. I don't know. That's just what I thought
Deacon
of.
Pat, do you want to speak to that?
Yeah, well, I think a lot of this stuff, I already had stuff and was prepared to some degree.
He did.
For this. There's a few things I will do different in terms of preparing in the natural. But yeah, you know, when it comes to the supernatural, we should be ready to go every day. And that's a challenge, you know, in terms of keeping that, again, that eternal perspective day to day. But I think one of the dangers I see is we as human beings forget so quickly, and not let this go by in terms of, because how many of you out there who may be listening to this have actually lost somebody you know from COVID? You know somebody, and I ask that question to people, and very few of us, because it really is a low percentage. Most of us don't know somebody personally who died, and that will be easy to forget in terms of we'll go on our business as usual. Now, hopefully we learn something from this. And again, we don't want to have a culture where we go around in fear all the time, because there's so many things that can kill us. The flu, auto, every time we get in the car, et cetera. So, but at the same time, to be prepared spiritually, physically, is something we need to look at and push our government to be ready for, so that we can bring out the masks and glasses and everything really quick, and people can keep going to work and keep the economy going. We would have been better prepared for this, then we wouldn't have this huge economic meltdown too that we're having to deal with. And those of us who are more fortunate, because I'm retired, obviously we need to look at helping those who are less fortunate. And the effects of this are going to go on for who knows how long, years probably, in terms of how it's going to affect us and the world economy. So they bounce back quickly because we are pretty resilient. You look at the history of the U.S. and we have bounced back pretty quick. We've had, during the Great Depression, it took a while. So anyway, preparing.
I like that song in Lion King, Be Prepared. And when I first started being a speaker, I always prepared a lot in the natural. I studied, I memorized my speech, and I went forth and gave it like I was giving it from my heart. But now I prepare in prayer more. And the same way in this particular trial, we need to be preparing in prayer. We need to just pause, listen for that still small voice, and he may say for you to do one thing and someone else to do something else, but do whatever he tells you to do. He's preparing you for the days ahead for you, the path ahead that you're walking. No one's walking that path except maybe you and your husband or your children. Pat and I pray every day for our children. We pray the blood of Jesus over them because it's a protection. We encourage them in the faith. As a parent, we know, well, Mom, you never put in your pink slip. You have to always be prepared, but prepare mostly in prayer. And then for my last question, before you go to last word, I want to ask Deacon Dr. Pat, this trial, a lot of people, especially Amanda and her friends, are asking each other, that's our daughter, what are they going to change once they get out of Dodge and they're able to break free and, get in line and live their life in a different way than we've been doing? What are they going to change because of it? And so what do you think, how would you address that to the people out there? Take a pause and think about what you would change.
I would say, other than what we've talked about, to keep abreast of what's going on and what information is out there and make changes on that basis. But at the same time, you can go, like we said earlier, you can worry about getting in the car and not ever doing much of anything. It's staying in your house and not doing much of anything because you're so fearful.
But I mean more
But you don't want to do that, so you want to be able to be prudent, but at the same time, live your life and not make your kids fearful. One of the things that, how is this going to affect our kids, in terms of, and how do we comfort them and help them not to be fearful, because they see this all going around and this huge change in their lives. And so what's going to be the impact on them, because they're more vulnerable, I think, than obviously adults are. They also tend to be a little more resilient, but this could certainly have a huge psychological impact.
Sure.
And I think parents out there need to really be asking their kids, what are they thinking? What are they feeling? As we get able to go out and do more in the culture, and to be ready to help them and answer their questions.
Jan?
I was just when he was just talking about the word fear. Well, here in where we live, I really like it because pretty much almost every neighborhood has put up crosses, and it's and then they put lights on them, or they drape some material over them. But our neighborhood is almost every house has a cross in front of it, and really our town, and it's a symbol of faith over fear.
I think that's
so
great.
I think it's been great. In fact, I think I might end up posting that on my Instagram, just going through and looking at, and a little video of everybody's crosses, because all of them are different. But that's what everybody in Macon. I mean, well, that's where we are. So that's what's been happening. Everybody's been putting crosses up in their front yards, and it's faith over fear.
I just love that. Cherry's neighborhood, our daughter, Charity over in Evans, they did that in Barton Trail. I was so blessed by that. To have God-centered neighborhood, someone's got your back, and you can almost you feel like I can do all things through Christ who strengthens me. It's a daily reminder, in the natural, you see it, so you visualize and remember. What a great thing. Deacon
And what'd you put on the door, Ellen? What'd you put on our door?
We put on the, Our Lady, let's see. Oh, no, I forgot. St. Faustina, Mercy, the Mercy, Chapel of Mercy, Jesus, the picture she drew. But we're almost towards the end of our show, and I have you right on the air there. Would you want to say anything else before we close out? And then we always end our show with last words. This isn't your last word. This is just like tying up loose ends of something we didn't ask you. We enjoyed you.
Yes.
I would go back to what St. John Paul said and wrote a book on. That be not afraid.
That's right.
Trust in Jesus. Turn to Jesus. And each day, as you say, ask the Holy Spirit to guide you. Ellen and I pray every morning, come Holy Spirit, to guide us. But we have to listen to what he's saying to us and be open to what he's saying.
Listen.
So we're going to go with last words. Jan, you could go first and tell where you can reach you.
Oh, okay. Yes, you can reach me at www.dimeadozenmom.com. That's where I blog, and then also my Instagram post, which is Dime a Dozen Mom, and I also have a Facebook. And those are the places you can reach me. And I also post up most of I'm still working on it, but I have a lot of our on my website. I do have all of our our podcasts that are up on there, and people can go and listen to them.
So how would you top the show? Do you want to say something, Jan, that ties to the show for you, a last word that the people could take home to them, the moms or just the listeners?
Yes, I think that two things I want to say is that what we talked about is that we cannot, even though we feel the fear, we have to really, at this point, because we can't go to the Mass, we have to really, I suggest, doing the daily liturgical readings, definitely doing the spiritual communion, and really, like I said, the feelings of fear will come, but we have the Word of God to combat them. Also doing the spiritual communion, and then also what Deacon Pat said is using prudence as well, but also listening. This is a time for us to listen. On then we can, I think of our Blessed Mother and Joseph when the angel came and gave Joseph the dream, get up and go to Egypt. This is a time for us to start to really calm ourselves and listen to what the Holy Spirit, listen to the Lord and what He's telling us, and it will be different for each family as far as what He wants us to obey and to do. So those are just a couple things I want to leave.
Thank you so much, and Deacon Pat, we thank you so much for being on the show. We always let our guests tie it up the way he wants people to remember the main things that you want them to remember.
Jesus is Lord. Jesus is in charge. Bad things happen in the world. and they will continue to happen. This is not the worst of times. Go back and look at the plague. That's why it's really important to know history. Things could be a lot worse, and things will get better. And so keep on keeping on and asking Jesus to guide you.
And if they want you to speak at their church or organization, how could they reach you, Deacon Pat, for speaking out on anything faith, family, or even medicine?
Well, my email is P as in Patrick, MONGAN at Augusta, AUGUSTA .edu.
Thank you. I might have you back for one more thing, so don't hang up, please. This is Ellen Mongan at Wow Mom. We had a great show today with Deacon Pat. He's a doctor and a deacon. He's actually the father of all my 8 children and the grandfather to 14 and the deacon at St. John the Evangelist Church here in Vieira, Florida. So you can reach him at that as well, St. John the Evangelist at Vieira, Florida. But I want to top this show by saying this. You know, when you have a trial in your personal life or in your family or in the world, it brings out either the best in people or the worst in people. And we see here so many people reaching out. I watch Kelly Ripa. Everybody knows that. I like her. She's Catholic. And she is an inspiration every morning. And she donated a sum of money, really good, to people. I was impressed by that because I thought, it made me start thinking, what can we do, Pat and I? So we did some things as well. And everyone has their portion. No one can do everything, but y'all can do something. So pray and ask the Lord, how can I make this trial turn around and do something and bring out the best in myself to help another guy? There's so many needs in this world. There's so many crying outs. So you have to know where God's asking you to deposit. I like what Rachel said last week. Keep your eye on your own paper. Don't see what someone else is doing, because God has a job just for you. He also has a ministry for you to do, and he has something for you to do to help this situation. So, Deacon Pat, one more time, how to reach you, and we're glad you're on our show.
Glad to be here.
You did a great job, honey. I love you. This is Ellen Mongan at Wow Mom. You can reach him all those places he said, but you can reach me at wowellen@yahoo.com, and I also write for Catholic Mom. Today, if you hear his voice, harden not your heart. We thank you that you joined us today at Wow Mom, and that we hope this show is one you watch and pass on. My husband's a wealth of knowledge. I would say that even if I wasn't married to him, he's still the star in my life, and he plays first place. This is a time to build family, build friendships, and build a relationship with God. You have the time. So please take the time today, watch our show, and then take time to listen to what we said. Jane Ann, thanks for being my co-host. I enjoyed it.
Thank you. I enjoyed it too, as always. Thank you, Deacon
Deacon
Pat.
Deacon Pat, we love you.
Welcome.
Both of us. The world loves Deacon Pat. Have a great day. I'm signing off if I could do this without too much complication. So, and thank you again. Pass it on.